Practitioners end up at risk in drug testing because they lack knowledge of medical policies that the payers put out on medical necessity. They also can get into a lot of trouble if they don't understand the mechanics of clinical laboratory between presumptive testing and definitive testing. It's important that the provider do due diligence before they get into any laboratory arrangement, whether it's their own laboratory or with an independent laboratory. And that's where a lot of the cases have happened in the last year. There have been several lawsuits, criminal cases and fraud investigations. And most of it relates to lack of knowledge of medical necessity and lack of proper documentation. Well, there are ways to document medical necessity, and the most important step that a provider can take would be to go and understand what a state licensing board wants them to do regarding drug testing, and then compare that with a carrier's medical policy on drug testing, and then kind of create their own template so that they can document what's required of them on both sides, the licensing board and the payer, and tell them this is why we're doing this testing for this patient, and most importantly, this is how we're going to use the test results, or this is what we're doing as a result of the test. Primary care, needs to understand that there are requirements for drug testing and that the frequency is not tied to their individual subjective perspective of whether the patient's at risk or not. It's the fact that the patient's using an opioid, and if they're using the opioid chronically, primary care practitioners should remember drug testing should be part of their risk management protocol, and they should endeavor to look at their licensing board materials and medical policies to understand when they should order these tests and what should be documented.